Good afternoon. Today is Tuesday, April 13th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me again today is Diane Oldenberg, Senior Public Health Educator for the County Health Department. I'm sure many of you have heard already, the CDC and the FDA released a statement today recommending a pause in the use of the Janssen, Johnson & Johnson vaccine while they study a possible link with a rare blood clot disorder among some of its recipients. Although the FDA said that the disorder appears to be extremely rare, Oswego County is following the lead of those agencies and the State Department of Health to pause the use of the vaccine also. We have not been made aware of any cases of blood clots or any serious reactions after the County Health Department's administration of the Johnson & Johnson vaccine. We will continue to monitor the Moderna vaccine and have scheduled our next vaccination clinic for this Saturday, April 17th at G. Ray Bodley High School in Fulton. Appointments are available for first doses of the vaccine from 3 to 4:30 p.m. The link to register for that clinic is now posted on the Health Department's COVID-19 vaccine page. Go to health.oswegocounty.com and click on the link for local information about the COVID-19 vaccination. The Oswego County COVID-19 hotline is open weekdays from 8:30 a.m. to 4 p.m. to help people make appointments as well. Call 315-349-3330. The Moderna vaccine is a two-shot series that is only approved for those aged 18 and over. Those who sign up for this clinic must be able to return on Saturday, May 15th for their second dose. You can find more information about all three COVID-19 vaccines by clicking on the fact sheet link for each one at covid19vaccine.health.newyork.gov. As vaccine eligibility has now opened up, and with a pause of the Johnson & Johnson vaccine, clinics will likely fill more quickly. Still, keep checking back even if a clinic looks like it's booked. Appointments may become available if other people cancel or reschedule theirs. As of today, 34.5% or 40,693 Oswego County residents have received at least one dose of the vaccine, and 30,098 residents have completed the vaccine series. Although more of our residents are receiving the vaccine, we have not seen new case numbers decrease as we would expect. We can't let our guard down yet. We must continue to follow safety protocols to protect our loved ones and communities. And now Diane will update this week's COVID-19 report.
Thank you, Chairman Weatherup. Our 7-day positivity rate has decreased from 2% to 1.7%. As of this afternoon, we have 213 total active positive cases. We have 185,926 total tests have been performed. We have 7,316 cumulative positive cases. We've received 176,084 negative test results. We've released 7,013 patients from isolation. We have 90 deaths related to COVID-19 as reported by the New York State Department of Health. And we currently have 499 residents in mandatory quarantine or isolation. The data shows that our daily positive case counts are relatively stable when compared to recent increases elsewhere in the state and nation. Still, they are also consistently higher than the pre-peak numbers that we saw before Halloween. So we continue to encourage people to get vaccinated. There are more agencies in the county now that can administer vaccine, including Oswego Hospital and Connects Care. Many area pharmacies are administering the vaccine in their stores, and some are partnering with local agencies such as Wayne's Drugs and the City of Oswego, and Kinney's Drugs and the Office for the Aging. You can also register for a vaccine at one of the state-run clinics, including the New York State Fairgrounds, through the state's Am I Eligible website. As the chairman has said, we have not received any reports of blood clots or serious reactions to the Johnson & Johnson vaccine that the Oswego County Health Department has administered. As with other vaccines, we have seen some recipients experience minor adverse reactions, such as lightheadedness or fainting. These reactions are not related to a particular vaccine as much as they are related to other factors, such as dehydration, anxiety, indoor temperature, and age. People should make sure that they are well hydrated and have eaten before they get to their vaccination. They should also dress in layered clothing that they can remove if they get overheated. Millions of Americans have safely received COVID-19 vaccines so far. The vaccines will be continually monitored for safety by medical professionals at the CDC and the FDA using both established and new safety monitoring systems. If you have any questions about COVID-19 vaccines, please call the county's COVID-19 hotline at 315-349-3330. Until we can get everyone vaccinated, we all must be proactive and responsible about preventing the spread of the virus, regardless of age and vaccination status. When you leave home, remember the 3 W's. Wear a mask, watch your distance, and wash your hands. Thank you.
Thank you, Diane. I want to remind everyone that local educators and workforce partners are working together to host a virtual career summit for Oswego County students. The event will run from 11 a.m. to 1 p.m. tomorrow via Zoom. Also, Friends of Camp Hollis opened its first 5K run walk event, which will be held virtually throughout the month of May. There is more information about these programs on the county government website at oswegocounty.com, along with the latest information on COVID-19 clinics and testing. I encourage you to check back frequently as things continue to open up. And finally, don't forget that the New York State burn ban remains in effect until May 14th. Last Thursday, the Constantia Volunteer Fire Department answered a call to a large outdoor fire. The initial alarm quickly escalated, and additional resources had to be brought in from the eastern third of Oswego County. Before it was over, more than 27 agencies and over 100 personnel from 3 counties, including the Oswego County Sheriff's Drone Unit, Onondaga County Sheriff's Air 1 helicopter, and New York State Forest Rangers, battled the fire for 8 hours. This has not been the only such incident. Fire departments have been responding to numerous calls across the area, with many events requiring multiple departments. These calls stress our already limited resources and take our firefighters away from other, more serious incidents where they may be needed. For more than a year, we've been talking about working together to keep our communities safe. This is an all-encompassing effort, and we need everyone to do their part. This means following the COVID-19 protocols and obeying the state's burn ban. Thank you for all your cooperation and for working with us to protect our communities.